head this way. And I'm going to have you help a little bit. I don't want you in pain. Does that hurt you?
Not much.
Not much. Pull back against my hand. Pull back against my hand. Do you notice that that's weaker?
Yeah.
Okay. We're irritating your nervous system. Pull back against me. Pull back against my hand. Pull back against my hand. Now, what happens, pull back against my hand, when I touch just like that? It's easier, meaning your arm got what?
Stronger.
Okay, very clear to you?
Yes.
Okay. So, she's got an anterior atlas on the left. So we're going to go back to old school B.J. Palmer toggle, right? Now, I'm not a piezoform guy, because I don't think I can get enough precise contact with my piezoform, so I'm going to actually put my thumb in there and drop. I love drops. Drops are easy. I can make corrections on drops that I can't make without drops. This really gets my attention. Everybody see your pretty foot? What's going on with that foot? Yeah. Were you born with the bunion?
No.
Okay, you acquired it.
I did.
So when you look at most shoes that people wear, you should actually look at mine. Mine are the best shoes you can put on your feet, right? What they found out is that shoes are screwing up people's feet, and shoes are screwing up the sense of balance. Now, I believe hers is coming from inner ear, but the highest concentration of proprioception is body, spine. Number 2, feet.
She got a second toe on. She got more.
Probably. Looks like it. No, actually she doesn't.
Oh.
Yeah, so that's a classic sign of like B6 deficiency, right? But, so shoes, it looks she's got better shoes on than most people. I had an 80-year-old woman come in with custom orthotics with the toe box built up this tall because the great toe was completely crossed over the next toe and the little toe was greatly crossed over the next toe, and she's having a hard time balancing. Well, imagine that. Your foot's screwed up from bad shoes, right? So we want to wear good shoes. All right. Now, I want you to lift your head up for me, and let me know if any of this is really aggravating to you. Hold your head right there. And don't let me push. Chin right there. Keep your chin down. And don't let me push. Hold. So she doesn't do this very well. Fair enough. Does that feel like that's holding?
I had no control.
No control over is what she's saying. So somehow her neck muscles aren't working very well. And how's this? Tender at all?
Yes.
Is one side more tender than the other?
Right.
The right is more tender. All right, so what I'm going to do now is put on a glove, and I'm going to push up on the roof of your mouth, and I'm... What do you need to do?
I got a cramp in my arch when you did that.
You got a cramp in your arch when I do?
When you were pushing there.
Oh, when I push there, you got a cramp in your arch. That's pretty fascinating. I don't have a clue. Ned, do you have a clue?
No, this urinary bladder one.
It goes down all the way,
Goes
doesn't
all the
it?
way down to the foot.
Yeah, you could certainly... What's my rule when in doubt? Acupuncture, right? Acupuncture is pretty cool. So, all right.
But also the fascia is all one piece, too.
Yeah, there's about probably a million explanations. My mind went proprioception. Ned's went acupuncture. Yours went fascia, and they're all right, but or maybe none of them are. But they're at least potential thoughts. Okay. So now, feel that pain. And what I'm going to ask you to do is raise this hand, because I'm going to have my hand in your mouth when I push in a way that relieves the pain. Okay? So we're going to put that back down. If I push and it relieves the pain, go like this. Okay? So here I am, and we're here. There it is. A very unusual vector, almost vertical. Now, what I'm going to do is push there, and I want to test your neck flexors the same way they were. I'm going to push pretty good because I'm a good pusher. And lift this up right there. Hold strong for me. Hold strong for me. Now, is that different?
Yeah. Amazing.
Yeah, it's quite different, isn't it?
Yes.
It went from how much control
None.
to how much control?
I'd say 100.
That's not bad, right? 100% change is a pretty cool change. Now, granted, I want to fix her balance issues, right? But if your head isn't working right, what happens every time you take a step? Can you look if I'm going to run, what does my head do? Absolutely nothing. What does my torso do? My head must have proper firing of my neck to let me understand where I'm going. Imagine if my head went like this every time I took a step. I'm almost dizzy from that. It's all got to work. And in her case, something's not working with her neck firing that's related to her head. We also see that she has an upper cervical problem, right? So now when people come in, they want to know the answers to 4 questions. Number 1, what's causing the problem? I don't know, but I find some things that I commonly find related to equilibrium problems. Question 2, can I help? My answer is always the same. I don't know, but I'll try. How long does it take to make a difference? I'm going to work hard enough, aggressive enough, which is going to be very uncomfortable for you, to try to make an instant change. Is that okay with you? Probably going to put you through 2 minutes of grief. You're not, why are you crying? You're not crying because, why are you crying?
I'm crying because I'm afraid of pain.
I hope these are tears of joy. They could be, I don't know. They are? They're tears of joy? They're tears of joy because someone's given her hope for the first time in a dozen years. Isn't that cool? That's kind of cool. All right. Last question is cost. Here's the good news. It doesn't cost you a nickel. Now, in my office, it'd be a $119 visit. And then $395 for the biochemical follow-up. But guess what? We're going to change her life, hopefully forever, get her 10, 20 extra really good years. That'd be kind of fun. All right. So, let me know when you're ready. Okay, so here we go. So, her skull feels very much like concrete. Extreme concrete. Now, I have a friend who's a black belt, 7th degree, can put his fingers through sheetrock. He brought his wife to see me. And she had sinus issues. Give me 20. 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. He can put his fingers through sheetrock, but he brought his wife to me with sinus problems. I drained her sinuses. I taught Grant how to do it. He's a chiropractor in Atlanta. So he comes back a week later. He says, I don't know, Bob, I'm doing something wrong. So I said, show me what you're doing. I said, well, that looks right. So I stick my fingers in Tammy's mouth. She goes, oh my God, you're pushing 10 times harder than Grant. And the guy can put his fingers through sheetrock. I can put mine through cinder block. I won't do it because I don't want to show off. Yeah.
So you have to put that hard on this one?
You have to do it hard enough to move the bone. Now, I was taught by heavy-handed people, and I have tremendous success. Who's my light bringer person? You may not have to, right? Maybe it takes you 2 hours to get to the same place as me.
Is there anything in between?
I'm sure there is, right? Bodies respond to frequency, duration, intensity, quality, and timing of stimuli. So I'm going to go intense enough that I can do this in a 15-minute office visit and move on to my next patient. Now, you might want to spend 2 hours rocking the skull, which is cool with me. You know, I'm not going to tell you how to practice. I don't care how you fix it. I just care that you fix it. It's always the deal. But if you got a busy exec on the table, you go, okay, I need about 2 hours. They go, well, sorry, I got a meeting in 45, so sorry, you know. That's okay. Schedule for 2 hours tomorrow. All right, I'm going to listen up the other side. How are we doing?
Fine.
How bad was that?
Child labor.
Child labor. They have child labor laws. All right, let's go to the other side. me 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Why are you doing the other side? Or are you doing the same stuff?
No, I'm doing the other side because I found that I get a clinical better result. Now, I'm not done till I'm done, but while I'm here, she didn't like that one, which I find fascinating because that shouldn't have been anywhere near as bad as me pushing. But her pterygoid was one of the tightest little wires I've ever felt. How bad was the pterygoid? That little muscle I just pushed out. But that was quick, right? That was a nasty pterygoid. Muscles move bones. It's connected to the bone I'm moving. I better relax that muscle. Now, tell me about the tenderness up here.
It's almost fine.
Almost gone. 0, no change, 100, perfect ideal. How much better?
Probably
80 is not a bad change. We may not get 100 the first shot, but that's a pretty good sign that we moved some things in the right direction.
Oh,
All right.
thank you.
Now, slide down towards the foot of the table if you would. And I want to see how you make this drop work. Looks like it. Okay, come on. So give me a student who has no confidence in their upper cervical at all. Good, come on. All right. So here's what I want you to do. I'm going to open up her neck like this. I'm going to put your finger exactly where I want it. And then I'm going to have you drop. Let me have your hand right here. You put that one thumb on and you're going to go boom, just like that. Right, yeah. Where I put your thumb, put your other thumb on your thumb and drop. Okay? So let's get in there together. You support that however you need to. I'm bringing this back. You got your contact made. And I'm going to set the drop. It kind of goes north, so thrust with a little northward push, just as hard as I showed you on your hand. Go ahead. Beautiful. That kind of woke up your eyes. What'd you feel? Anything?
Right now I feel a little bit of this imbalance.
It just came on after that.
Yeah.
That made her feel a little imbalanced. Good sign or bad sign?
Good time.
I'm going to call it a good sign. Turn your head down. Way better, right? You are beyond a pro.
Good.
Pull back against my hand. I want you to turn that. I'm going to give it some crank. Pull back against my hand. And we're good. Okay. Now, equilibrate for a moment or so. And then I'm going to have you stand up and do something to try to see if you're able to perceive a difference. Okay? When you're ready, come on up. Do whatever you need to do. Move around.
Bob, what is their normal movement? If you get out of bed, from the edge of bed in the morning, do you feel?
I will often bound off to the right.
Come on up.
Okay.
Do something. Test yourself.
Still feeling a little, but not like it was.
What's different?
I'm feeling some better.
Some better.
I'm not quite there. Still. It's still there. I'm feeling a little bit, but nothing like I was before.
So 0 is no change, 100 is perfect ideal. How much better do you feel right now?
I'd say 75%.
Well, have you felt that level of difference in the last 12 years ever?